Cannabis is often introduced as harmless, a natural remedy or harmless habit. For many people, that is true. But for a significant number, cannabis becomes something more complicated, a compulsive pattern of use that is difficult to stop. Today, we confront a persistent myth that cannabis is non-addictive and look closely at why heavy, high-potency THC use can lead to real physiological and psychological dependence and what clinical programs are doing to help. Start with the biology. The active ingredient that most users seek is tetrahydrocannabinol, or THC. THC binds to cannabinoid receptors in the brain, particularly the CB1 receptor, which modulates mood, sleep, appetite, and stress responses. With occasional use, these receptors respond and then return to baseline. With frequent, high-potency exposure, the brain adapts. It downregulates receptors and alters neurotransmitter systems to compensate for the constant presence of an external stimulant. This is not mere metaphorical change. It is measurable neuroadaptation. Those adaptations translate into real symptoms when a person reduces or stops use. Two of the most common are insomnia and heightened anxiety. Sleep disturbances occur because the endocannabinoid system plays a key role in regulating sleep architecture. Suddenly removing high levels of THC leaves the system out of balance, producing restless nights, vivid dreams, or an inability to initiate sleep. Anxiety results from the same destabilization. The brain's stress circuits, previously dampened by THC, become more reactive. People who quit often report increased irritability, panic, and a sense of internal agitation that can feel unbearable. Equally important, many report emotional blunting or numbness. Chronic THC exposure can dampen the range of emotional responsiveness. The high becomes a buffer against unpleasant feelings. When use ceases, not only do negative emotions surface, but positive emotions may seem muted as well. Activities that once brought pleasure can feel flat. This emotional constriction is distressing and can drive relapse, because returning to cannabis momentarily eases the discomfort. Recognizing these effects is the first step. The next is understanding that effective help exists. Specialized clinical programs have evolved to address cannabis dependence with a combination of medical assessment and evidence-based psychological interventions, which is these programs start with a thorough evaluation, history of use, psychiatric screening, sleep assessment, and measurement of functioning. This diagnostic clarity allows clinicians to tailor support to the individual's needs, rather than offering one-size-fits-all advice. Behavioral tools form the core of treatment. Cognitive behavioral therapy helps individuals identify triggers and build alternative coping strategies. Motivational enhancement techniques address ambivalence about change and strengthen commitment to recovery. Sleep-focused interventions, including stimulus control and sleep hygiene, counteract withdrawal-related insomnia. Anxiety management teaches breathing techniques, grounding exercises, and exposure strategies to reduce fear and avoidance. Importantly, emotional regulation skills, such as mindfulness, distress tolerance, and values-based action, help people reconnect with experiences that feel meaningful again without resorting to cannabis. Some programs incorporate medication management for symptom relief when appropriate, though there is no single approved medication for cannabis withdrawal. Medications may be used short-term to address severe insomnia or anxiety under medical supervision. Peer support and group-based treatments also play a crucial role, offering social reinforcement and modeling of recovery. Quitting cannabis after heavy use is rarely a simple matter of willpower. It can involve a cascade of biological and psychological challenges that make cessation feel daunting. But understanding the mechanisms, how high-potency THC reshapes the brain, and how those changes produce insomnia, anxiety, and emotional numbness, helps destigmatize the experience and points towards solutions. Specialized clinical programs offer structured, compassionate pathways through withdrawal, equipping people with the skills and supports needed to regain balance. For those struggling, help is available and recovery is possible.